And welcome back to Houston Newsmakers. The Episcopal Health Foundation is focusing on what they're calling 3 new priorities for change, and we'll talk about them specifically in a bit, but here are a few points. Regarding nutrition, 4 million Texans experience food insecurity. Regarding maternal health, 90% of maternal deaths are preventable, with Black Texans dying at twice the rate of white Texans. Regarding diabetes, 9 in 10 cases are preventable, with the rate of diabetes in Texas higher than the national average. Well, here this morning to talk about this next big leap in the Foundation's strategic plan and how it will impact all Texans, Dr. Ann Barnes, President and CEO of the Episcopal Health Foundation. Good to see you.
Good to see you, too.
I want to talk about some of the specifics of this plan first, but I want to talk about your role as a physician. You've actually seen people who have maybe not been nutritionally healthy, maybe have not had the maternal care that they need to have. How has that role that you played as a physician helped you really get all in on this plan going forward?
Well, as a physician, I've had opportunity to have long-standing relationships with patients, and what they tell me is that the conditions in which they live make it really hard for them to live healthy lives. Sometimes they don't have access to healthy nutrition, healthy places to exercise. They may not be in a safe community environment, and all of those things will impact a person's health.
So when you think about this, how is the Episcopal Health Foundation positioned to actually make a difference in putting these programs into practice?
So at Episcopal Health Foundation, we are really focused on promoting equity by addressing health and not just health care. Episcopal Health Foundation has been in existence for 9 years, and we've established wonderful working relationships with clinical providers, state agencies, but also community collaboratives and organizations that are looking at how do we improve non-medical factors that influence a person's health. We're going to build on those relationships and the work we've done so far to really focus on these 3 important priority areas that you mentioned when we began.
Okay, let's talk about some of them. First of all, we started out something simple is good nutrition. I talked about your statistic about 4 million Texans being food insecure. What's within these numbers are the elevated number of Blacks and Latinos who also are below the poverty line. They're dealing with this. Specifically, what is it and how are their lives impacted by being food insecure?
So we know that good food is essential for good health. We believe that poverty and discriminatory practices have put certain populations in environments that don't promote their health. And as it relates to food, there are parts of our community that are considered food and nutrition deserts, where there aren't grocery stores that sell healthy produce and things that would really improve someone's well-being.
You know, the equity piece about what you're talking about in most recent years, has become a political term as well. I mean, do you find people pushing back just because of the political way that equity has been kind of misjudged, if you will?
Yeah, and you know, we try to avoid conversations that get us trapped in semantics. We believe in equity, but I think that when we have the opportunity to show numbers and how not all Texans have good health outcomes, which I believe is what Texas would want, that no matter where you live, what language you speak, what your economic status is, that you deserve to be a healthy Texan. And so we try to focus on data and engage change makers and decision makers in conversations about improving the health of their constituents and their communities.
Maternal health is a big issue. It's been a glaring one for many years. You say 90% of maternal deaths are preventable. So many more Blacks than other ethnic groups dying. Talk about why you think that is and about the plans for the foundation to make a difference.
Yeah, so in this next year of our work, we're going to be doing a lot of learning about all 3 of the priority areas. But what I can share is that in addition to clinical factors, where some Black mothers don't feel that they're treated the way they should be, or they don't have access to health care, and so they're not getting prenatal care when they should, or postnatal care, those factors can influence whether or not a woman has a healthy pregnancy. But likewise, those non-medical drivers like food, like social supports at home. One of the things EHF was able to do this year was to spearhead a bill that passed, Bill 1575, that requires, under the Medicaid program, for children and pregnant women, that those women be screened for non-medical needs, and that doulas and community health workers be available to those mothers and reimbursed for case management of those high-risk pregnancies.
And that's something that's passed as a result of what part of what you did.
We worked with many others, but yes, we were a part of the group that got that legislated.
And that's called progress, isn't it?
It is, and it's at a system level, because when you can change programs at the Medicaid level, you're talking about influencing millions of people, millions of Texans.
Okay, let's talk about diabetes, because that has a much bigger impact overall on health than many people are aware. The rate of diabetes in Texas above the national average. Interesting that a lot of that, what goes into nutrition and exercise piece, has a lot to do with how many people have diabetes when they get to the point where they're monitoring their sugar levels and needing to take insulin. That's gone beyond where they probably needed to go. Talk about your program and what you're planning to do in that space.
So what we know is that if you look at people with diabetes and you look at people with pre-diabetes, which is something we can check, we are talking about 50% of the Texas population, 50%. And so we believe that we are going to need to work with communities and have them help us reduce barriers to healthy lifestyles. So as you mentioned, physical activity, safe places for them to exercise with their families, and then access to nutritious food, which ties to the first priority that we talked about. How do we get healthy foods to individuals at risk for diabetes?
All of these things are talking about 2024, correct? I mean, putting these things into place in 2020.
We are going to begin to put things into place, but primarily we are going to, because we recognize these complex issues we can't solve alone. So we're going to be bringing in partners, existing partners, new partners to join with us in tackling these conditions, and we'll fully start to implement the new plan in 2025. But next year, a year of learning and piloting some things to see if we can make a difference.
I'm smiling at you now because I've known you for a number of years, and I've always known no matter what you do, it's always about passion and you care, and what you're doing now is amazing, being in charge of this organization, which is so fabulous for what it's doing for Texans. It's just right in your wheelhouse. So I'm just so happy to see you doing what you're doing. Thank you.
Thank you so much.
Appreciate it so much. Looking forward to seeing some of the results of this going forward as well.
Absolutely.
Hey.